Hello, I am Joanna Mackenzie and I work for the Data Lab as Principal Data Scientist. The Data Lab is Scotland's Innovation Centre for Data and AI, and today I'm going to talk about data-driven decisions for a pandemic. Let me get my slides up. Okay, so the question I'm going to answer today is, what can we learn about data-led decision-making through the UK's COVID-19 response? Now, let's be clear, I'm not setting up to do a critique of the UK government's response. Neither am I making any claim whatsoever about whether they intended to do a data-led decision. I'm simply using the scenario of the UK's response to COVID-19 to start thinking about what a data-led strategy means and what it looks like in practice after a crisis happens. I think it's quite an illuminating strategy to look at a crisis and the response to a crisis and understanding what it means to be data-led and how data-led decisions can really aid a response. So any organisation, any endeavour that you might be involved in is always going to have a certain number of questions. You might be asking yourself how you go about something. You might be thinking about how many of something you need. You might be questioning the ethics of something. Should you do something? Should you not? And what's the best time if you're going to do it? We all navigate a series of questions all the time. And in fact, questions and decisions are extremely well connected to one another. Decisions are often driven by questions. If you can answer the question fast enough, you can inform the decision, and informed decisions are better decisions. They're more likely to be the right decision. So if you are doing data right, if you have the strategy, then your decisions should be better. And that's the real reason for having a data-led strategy, for enabling data-led decisions. Of course, I'm going to return to this point a few times in the presentation. Data-led decisions are not the only purposes of data in an organisation or an endeavour, but it's the one I'm going to talk about the most. I think it's important when you're looking at a data strategy to consider a broader information framework and think about the position of data in that situation. So there are always things that you can assume. Base knowledge, it might be organisational knowledge, it might be general cultural knowledge, but there's always a certain number of things that you can assume. There are other things that you only establish from research, and the final category are things that you learn from data. So taking some examples from the COVID-19 response, there are things that we can assume. So basic disease behaviour, basic human behaviour, scarcity of key resources, vulnerabilities or evolving knowledge, and international similarities are all things that we can assume. There are things that we'll only learn through research, so treatment options, advice optimisation, access to testing or vaccines, general epidemiology. All these things are all research-based information and knowledge. And from data you get fairly straightforward things. How many cases, how many of them are serious? How many deaths? Where are they located geographically, and what type of demographic are they impacting predominantly? How do they change over time? So assumptions are fairly static over time because they come from a broad level of base knowledge. Research evolves fairly slowly because it comes from a really in-depth and painstaking research process, and you only move forward these types of questions by taking the time to really establish what the truth is. So it evolves slowly. That sort of knowledge will evolve over time. But data is pretty rapid. It changes pretty rapidly. The number of cases today is not the same as the number of cases yesterday, and being able to compare today with yesterday gives us an extra data point, gives us an extra bit of information. So the sort of data that I'm talking about when I'm talking about a data strategy, when I'm talking about data collection, is this rapid changing data that is relatively simple on its own, very powerful when it's processed correctly and used correctly, but does evolve rapidly and does change very quickly over time. So I'm talking specifically about this type of data when I use the word data. It's also worth thinking about what a data strategy actually is. So essentially, if you're building a data strategy, you're talking about assessing what you will need to know to make good decisions at a later point. bring back in my caveats. Firstly, not only leaders need to make decisions from data, which can be a real failure point of a data strategy if you're not accounting for people who need to make decisions from data but are further down in your organisation. And also, there are other purposes for data in an organisation that are not making good decisions. But we might ask, as part of our data strategy, what data we have, what data we need to start collecting, and what processing do we have to do in order to support our decisions? And that third one is all about timing, because if you need to make a decision in one day and it takes you 4 weeks of processing to get to the data that's going to inform that decision, then your timescales aren't going to match up and something needs to give. So processing requirements and people that you need and the techniques and tools that you need in place are also part of making sure your data strategy is something that you can put into place in reality. And when things change is a really good study point for any sort of data strategy. So a crisis is a good time to reflect on, because it does represent a moment of substantial change. It can introduce new context, new imperatives to a strategy, and that gives you a good reason for revisiting it. And COVID-19 has been an unprecedented crisis, and it has absolutely undoubtedly impacted all of our assumptions about the future and what it might look like, which makes it quite a useful thing to establish a new data strategy as a hypothetical exercise, of course. So let's go back to the COVID journey for the UK. So we'll start back in the period between December 2019 and March 2020, which I'll call the crisis point, because it's when we started to understand that the crisis was actually happening. In December 2019, we actually only knew that there was a pneumonia of unknown cause. That's from the World Health Organization. It was centred in this area, Wuhan in China. And we didn't know very much more about it, but we were starting to become aware that it was very serious. It had 11 people of 44 were severely ill. So first indications that something might be happening. In the UK, our first cases were confirmed on January 29th, 2020. They came from China. But the UK lockdown actually started further in March 23rd. There had at that point been 6,650 known cases and 335 deaths. Now, at this stage, testing was pretty restricted to hospital settings only. That meant that the reported numbers were much lower than reality. And that's not something that I'm imposing on that information with hindsight. That was something we knew at the time. We didn't have the capability, we didn't have the infrastructure, we didn't have the pharmaceutical support to actually test the whole population. So we could only test people who were at the most severe cases, and we knew that we were undercatching those cases. But we still made our decision. Our decision was the UK should go into lockdown to prevent the further spread of COVID-19, and that should start on March 23rd, 2020. So we made our decision. We had looked at our information and we made our decision. Now, this is what you might call a crisis decision. They're very rarely data-driven decisions because they occur in times of substantial change. And unless you are already extremely data-led and have exceptionally good data infrastructure in place, your data is not going to be able to track things that are changing quite that quickly. So generally speaking, crisis decisions are not data-led decisions. They're decisions of risk mitigation, they're decisions of best available knowledge, and they're decisions of empathy and human connection. So you make the decision to deal with the crisis. And quite often you haven't got anything like enough time or headspace to start thinking about a data-led approach in this sort of crisis. So that was the case very much in the COVID-19 response. So what's our information framework look like? So the things we can assume, back to the same framework as before. We knew that hospital demand would increase. We knew it was quite serious. We knew that intensive care beds were going to be in high demand. So there's a few things that we can see there. We could also take a guess at some things that the population could do to reduce the possibility of further contamination, further spread. We could take measures to reduce contact between people. We could think about washing, sanitising hands. And we had some questions back in the sort of January to March time. Should we be wearing masks? Some countries did. How significant is surface contamination? Do we have to avoid pressing buttons on pedestrian crossings or wash all of our groceries before they come into the house? These things we didn't really know at that stage. There are certain things that had to be established quite quickly from international collaboration and research, such as how do we treat people to begin with? Can we prevent people from dying from this? And who is the most vulnerable? Can we establish that? Do we know? And can we treat them separately and support them through this whole dangerous time? But data was quite a limited resource at this stage. There are a lot of cases, people are dying. Beyond that, we don't know a great deal from that sort of day-to-day data perspective. And from this scenario, we can draw out some principles of how you inform a data-driven decision. So the first principle I'm going to draw out is don't avoid decisions by looking for certainty in a crisis. It means a procrastination sometimes, looking for certainty when certainty is not possible. So we knew lockdown was necessary to control the disease spread. Looking for certainty, clarity, that is only going to delay taking the action that was inevitable and would allow the disease to continue to spread. Data-driven decisions are great, but data is not always necessary to take a decision. In March, we were already in a position to do a number of things. We could start predicting and mitigating resource shortages. We could set up research and funding on key science topics, treatments, vaccines. We could start working on a data strategy that would inform us later on. What do we need to know and when? We could start establishing global communication and information sharing with other countries experiencing the same crisis. And we could establish a methodology for communicating with the public all through this crisis. And we could do all of that without any sort of data strategy. We didn't need a data strategy in order to understand what needed to be done. So in March, we managed as a global community to actually make some progress on quite a lot of these things. And I think now in November, we're starting to see the rewards of some of these efforts. So with a lot of hard work and funding from a lot of people. But we didn't do that because we had a data-led strategy. We did it because we saw a crisis and we knew what we had to do to respond. So let's move forward a little bit in time. What I'm going to call the post-crisis phase. This is April into August. Things are getting a bit more normal again. It's a new normal, but it's starting to feel a bit more standard. We kind of know what we have to do at this stage. So we're working from home and we've got rainbows in our windows and we're clapping for carers, and Joe Wicks is getting us all to do our PE in our living rooms through YouTube. And that's kind of the situation that we're all in. This was the new normal. It was a big change from the previous normal. But we were starting to learn how to work through there. And we had essential workers, of course, that were still working all the way through all this. So let's start to look at the data that we had. Now, we've got more information at this stage. So if I look at the blue graph, you're seeing the plateau where the number of cases has gone from rising steeply up to the beginning of April. It plateaus through the entire month of April, and then it starts to come down. And that's what we're seeing in the data. But if you look at the testing strategy in the green on the lower graph, you see that the number of tests conducted starts off quite low, only less than 30,000, until around about the end of April, and suddenly ramps up quite substantially to 60k, and then ultimately up to 90,000 tests every day. And at the same time, the percentage of tests positive, so the dark green bar chart, starting to come down. So initially, at the beginning of this phase, we're testing hardly anybody, but most people who are testing, we're pretty sure they have it. So 40% of people are coming back positive. Into the end of April, beginning of May, suddenly that switches. Now we're testing a lot more people and far fewer of them are giving a positive result. So we start to know from this data that the line that we're seeing on the blue graph, where the number of cases are decreasing, is probably a real effect. And in fact, it's probably more marked in reality compared to what the data is measuring. So we can be really confident that the number of cases are in fact coming down because we're testing more, but the numbers are still lower. And these graphs are from Travelling Tabby's very excellent UK coronavirus tracker. So I've included the link in the slides. What sort of decisions are we making at this point? Well, we're opening dedicated COVID-19 hospitals. We're investing in increased testing and app development. There's travel quarantines that are being instigated but maybe not enforced. Different strategies in different countries were taken up. So these are some of the things that were happening in the UK at this time. We're almost in a post-crisis space here. The crisis was the point of change, and at this point we're now having to realise we're taking stock of what has changed from the world before. What do we have to discard from the previous time? Once the first crisis is past, we're starting to think about what new things we need to know, and in terms of our data strategy, we're starting to set up for the long haul. That, okay, this is a new normal, this is different. What's new? What do I have to do differently? So what's our information strategy, our information framework for this period in time? So things we can assume, with fewer cases, the hospital demand will ease. We're past the worst of it. But we do know that previous pandemics have seen a second wave. At this point in the timeline, we have no way of knowing whether a second wave will happen. It's entirely possible that with the information era, the amount that we now know about epidemics, we could maybe have avoided that, and that was a possibility at this stage. But we had to understand that second waves of pandemics was a big thing and could be a substantial contributor to the future pathway at this stage. We've got research going on. The treatment is starting to improve with global experience and collaboration across different medical research capabilities. And there's funding going on for vaccines and treatments. Epidemiology is working really hard. We're maybe not at this stage in the timeline seeing the results of that research. It's still evolving quite slowly, but it's all going on in the background. It's now been established. It's starting to look forward to what we need to know. And data, now we're starting to see the increase in testing, and that is what our data is in COVID-19. Number of cases are decreasing, and we're fairly confident about that because the testing has increased. Deaths are also decreasing, which helps us understand that the number of cases that are progressing to real severity is now coming down. And because we have a testing procedure which is available beyond the hospital environment, we can track possible contacts and cases before they become infectious and hopefully continue to pin down the virus beyond what we can do just socially. So lots of different things coming in. And what principles can we derive from this? Well, data, it's always context specific. When the context changed here, we've got a pre-COVID world and now we have a post-COVID world. And the data we're collecting has to change too. We needed to do the testing. We need to have the testing infrastructure so that we have information about where the disease is, who it's affecting, and what we do next. So the new testing strategy did change the meaning of how many new cases there are in a day. It broke that historical link with what we'd done in the past. So that wasn't really comparable anymore, what happened before that period in April when the testing started to ramp up, and what happened afterwards. But the priority here was enabling the good decisions going forward, not enabling comparisons with historical data. And there's another principle we can draw out here. When you're after the crisis, when you're looking forward to a new normal, you have to think not just about what do I need to know now when you're establishing your data strategy. You need to think about what will I need to know in the 3 months it's going to take to get that data in place. So new data doesn't, generally speaking, spring into place as soon as you know you need it. It needs to be identified and prepared. You need to think about surveys or testing infrastructure or sensors that need to be installed. You might not ever be able to answer today's questions fast enough with any level of data or any level of effort. But if you allow for that lag of 1 to 3 months that will take you to get that data in place and make sure you're collecting it fast enough, maybe your decisions in 3 months could be so much better. So if you can look forward and say, in 3 months' time, I will need to know this, and start that process now, your data-led decisions are likely to be much better decisions, and it will set you up in a really good stead for the future. So talking about the future, let's move forward again into phase 3. I'm going to call this a steady state phase because I think if you look back to September, that's more or less what we were trying to achieve, a steady state, a balance where we can keep as much of a world of normality as we could achieve, but still keep a lid on the virus. So steady state, we're looking for that post-COVID, we're looking for a new normal. And of course, what in fact happened is that we got to where we are now, which is that England is in lockdown, areas in Scotland are in lockdown, we've got different alert systems, and we're probably well into a second wave. So that's where we are now. But back in September, we didn't know this, and we didn't think this was necessarily inevitable. So let's look at how we got here. The second wave kind of starts to become apparent maybe August, September time. So cases are starting to rise up very slowly, but they are rising slowly. This is back to data from this Travelling Tabby UK coronavirus dashboard, so it's very useful visualisation. It doesn't start to really ramp up until late September, maybe into October. And the new deaths, again, it's low all the way through August and most of September, and starts to ramp up again into October there. So our data is informing us of what is happening. And we know that's what's happening. So what decisions are we making at this time? Well, what we're aiming for are ongoing micro decisions aiming at maintaining a fragile balance, a new normal. We're looking at moving between regional approaches where there's a spike in a particular area, and then a national approach later as it becomes more obvious that this disease is spreading nationally. And we're looking at economic stimulus to minimise disruption to business as far as we can make that happen. The aim of the strategy here is clearly about balancing not as much of normality as possible. So these are what you might call new normal decisions. So at some stage post-crisis is business as usual. It's the new normal. And the data strategy that you put in place has to support you in your new normal and work from the previous phase. What you learn from that immediate crisis and its aftermath can set you up well here, because the crisis will have taught you what the new normal looks like, especially if new normal is in response to the crisis. So what's our information framework looking into the sort of September-October timeframe? There are things we can assume. A second wave is possible. That was always an assumption if it wasn't contained that it might happen. It might not happen. Medical technology has come on a long way since the last time we had a pandemic, but it was always a possibility. And from research, containment, we knew a lot more about containment by the late summer. Masks are now much more central to our strategy. Indoor events are known to be a big risk, and we're starting to understand the contribution of super spreader events. And from data, well, a good strategy here, we would understand that to make decisions to contain the virus, we need to test, we need to catch as many cases as we can. We need to track, we need to be able to identify where the contagion is and lock it down before it spreads any further. And we need to be able to make decisions on the ground to contain that threat. So we sort of know that from data, that is the possibility, that is how you keep the number of cases low. There might have been some differences in implementation and practice to that sort of idealised strategy. And principle 5 is actually a more general principle. Data is most needed and it's most useful when decisions are the most difficult to take. So to bring in a parallel, an analogy, if you send out a boat in calm weather, that's an easy decision. It's likely to be safe. If it's very stormy, then keeping your boat home is also an easy decision because it's likely to be very dangerous. Now, where you need data is that in-between space, where waves start to become near the safety threshold for your boat. Data in that middle ground can help you understand whether the waves are below the threshold throughout your journey, or whether it gets worse, or whether it gets better further out. It can help you understand whether they're likely to get worse over time or get better over time. Good data, well-planned data, well-visualised data helps you make the right call to bring that boat home safe every time. And it's most critical when the decision is most borderline. So it's quite an important principle when it comes to making a data-led strategy and making data-led decisions, understanding that even critical decisions can sometimes be easy decisions because the route forward is clear. And data is really for the murky decisions where it's not as clear. So we've looked a little bit about how the COVID-19 situation and the UK context can help us understand a data-driven journey more generally for other endeavours and organisations. Now, one thing to think about, in March, we made decisions without the data. So what was different in September? Why did we need data more in the September? And it comes down to our strategy. So in March, the strategy was essentially we need to suppress the virus. And we did so at any cost. We locked down everything. Children were home from school. People were furloughed from work. And we just took the decision that we had one priority, and that was what we were going for. But we didn't make that call in September. We weren't looking for that. In September, we were looking to maintain a fragile balance, a new normal. We were looking for ability to keep the disease low and to keep normality going as far as possible. Balancing that is a hard decision. And it really, in order to succeed, probably really needs very, very good data. And I suspect that if we look across internationally, the countries that best succeed about maintaining that steady state balance are the ones who had the best data strategy in place. That'd be an interesting study. So my question at the beginning of this was, what can we learn about data-led decision-making through the UK's COVID-19 response? And we brought out 4 data-driven decision principles. The first one, don't avoid decisions by looking for certainty in a crisis. Use data when it's necessary. You don't need data, then don't wait for it because you're procrastinating. We talked about data as being context specific, and we're understanding that where context has changed, the data has to change too. You need a new data strategy, a new data approach. We talked about the fact that post-crisis, you need to think not just what do I need to know now, how do I answer today's questions? You need to look forward. You need to think, well, the data will not be in place for a few months' time, so what is it that I'll need to know then? And in times of particular change and upheaval, that can be the most valuable, but also the most difficult thing to do. And in fact, data is most needed when decisions are most difficult, when decisions are most borderline. So those are some principles. What does that mean for a data strategy then, a data-driven strategy? Well, actually, it tells us quite a lot about a data-driven strategy because a data strategy evolves. New context means a new approach. Now, you get new context quickly, if you're in crisis or major change happens. But you can also get it slowly from the gradual accretion of changes over time. So it is worth revisiting any data-driven strategy, making sure it's still connected to your business goals and your business outcomes. A data strategy supports, it's there to help you. It should inform the decisions you need to make. You might need the infrastructure that you put in place prior to the crisis, but you might find that you don't need that anymore. And if you don't, then you should dismantle it and put a new infrastructure in place that actually supports what you need to achieve. A data strategy, like the data itself, is most needed where the decisions are most challenging. It's that strategy that helps you pull everything together, the systems, the tools, the expertise. And those things are most challenging where the data is most needed. And you're going to need those things to really inform a better decision. And not all information is data. And I will return to my caveat that there are other uses for data in an organisation or any endeavour which are not driving better decisions. That driving better decisions is one of the hardest ones to get right. And that's me. Thank you very much for your attention. I hope that some of you made it to the end of this presentation. And thank you very much for your time.